Hey guys, so I want to talk about um, COVID-19 and our healthcare system's ability to address everything that came along with that, starting about 2 years ago. I remember when COVID-19 first started happening, there was a lot of confusion, a lot of different opinions on the virus that I think definitely contributed to our healthcare system's response to it. And this varies from the presidential seats opinion on it to healthcare professions, and a lot of just like clashing opinions on the priority of the virus and just how much attention it required. And I think it was downplayed a lot in the beginning. And I remember for getting treatment, healthcare and insurance was a huge thing when it came to that, and just figuring out like there's not a treatment plan on your insurance that covers a virus that no one saw coming. I also remember that there were like no beds available in hospitals, not only for COVID patients, but then for so many other people that were getting sick and still dealing with many health issues that didn't go away when COVID happened. And I remember when President Trump got the virus, it was a really big deal because he had been making many comments and made it seem like it wasn't a real threat. And so many people were upset when he did contract the virus and then immediately got the finest treatment available, while there were countless people unable to receive treatment at that same priority level. And I think that that can connect a lot to what we've talked about a lot this semester, and just marginalized people and how they oftentimes get pushed downward when it comes to priorities. And even thinking about the video from this week about the welfare warriors and everything that they did, and how to give a voice to this population that is so often neglected, I think. I also thought it was interesting in the PowerPoint for this week, it talked about healthcare as a right and not a privilege, and reading about different countries and how they approach their own healthcare system. That's also something that I talked about a lot in my high school classes. But I think it's really interesting how the United States is the only nation with a for-profit healthcare profession and provision, and how many other nations just have a system worked out where people are able to receive whatever treatment they need. Doctors are still getting paid, nurses are still getting paid, but there isn't this huge for-profit healthcare insurance entity. I also thought that it was interesting to read about the Affordable Care Act and everything that was made available because of that. I don't think I realized just how limited the scope of insurance coverage was before that, and just how maternity leave and a lot of different things were not covered in that. I thought it was really, really interesting to read about. And then the last thing that I wanted to talk about was when I was reading the article about the Washington Post article about what went wrong with the coronavirus test in the US. I remember testing was really confusing, and you didn't know if you got the PCR or the rapid test and what actually told you the correct results. And I learned that there was a 6-week series of glitches with the test, and so they lost 6 weeks worth of time that healthcare professionals that were researching this like couldn't make up. And a lot of that they blamed on a lot of pressure put on by the White House, they said, and just other higher up levels of the government. So I thought that was really interesting, just to see again how everything is so affected, and it's like this trickle down effect with those decisions. So it was interesting to read about that, interesting to think about, like I had forgotten about all the chaos about even just getting a vaccine, and how there was so much research, still is so much research pouring into that, and it felt like it was going to be forever until we did get a vaccine. And then just socially, how there has been so many conversations that have come about because of this virus.